What's up, guys? So, today I just want to talk about diabetes. So, my goal today is to explain what diabetes is and also talk about the differences between type 1 versus type 2 diabetes. But before I start, let me share my screen. Okay. All right, so you can't talk about diabetes without talking about the pancreas. So this picture right here, that's the pancreas. We have the head of the pancreas, the body of the pancreas, and the tail of the pancreas. This is just a cartoon view of the pancreas. So now when we look at this image right here, we can appreciate cadaver or real actual view of the pancreas. So the pancreas looks like this in real life. So when if someone was to die and then we were to take the pancreas from the person, this is how it looks in real life. So now in order for us to understand the concept of diabetes, what happens after we eat? So after we eat, what happens is whatever that you eat, the food is first converted into something called glucose. Why do we need glucose? So every cell in your body needs glucose, and glucose is what is converted into energy in the form of ATP, which helps the cells in the body to be able to function effectively. So when you eat, that glucose, which we refer to as the blood sugar, provides that energy that the cells need. So after you finish eating, that glucose will enter into the bloodstream. When glucose enters into the bloodstream, we don't want too many glucose in the bloodstream. So the pancreas, there is something called the beta cells of the pancreas, will secrete something or produce something called the insulin. And then insulin will go into the bloodstream. What is the point of insulin? The whole point of insulin is to make sure that they reduce the blood glucose, because we don't want too much glucose in the blood. When someone is diabetic, the problem is they have way too many glucose inside their bloodstream. So insulin's goal is to make sure you don't have a lot and loads of glucose inside the blood. All right. So now let's look at something here. This is a person without diabetes. So a person without diabetes, what is happening? You see that you can appreciate that the pancreas is working effectively. The beta cells of the pancreas is producing insulin. And then insulin is going straight into the bloodstream. And then insulin will bind to the glucose in the blood. And insulin will act as a key which will control the amount of glucose entering into the cells. Okay? This is a person who does not have diabetes. The person whose blood, everything is working perfectly. Now, let's look at someone with type 1 diabetes. So when we see a person with type 1 diabetes, the person has a pancreas. The problem is the beta cells of the pancreas, which are responsible for producing insulin, they have been destroyed. It could be the body destroying its own beta cells. So what happens is that no insulin is produced. So after you eat, there is glucose in the blood, but at this point there is no insulin to control the amount of glucose that will enter into the cells. What's happening right here? So there will be loads and lots of glucose which will be stuck in the blood because there will be no insulin which will help reduce this amount of glucose that will enter into the bloodstream. So when we talk about type 1 diabetes, basically this is when the body destroys the beta cells of the pancreas, so no insulin is produced. Now let's look at that type 2 diabetes. When we say a person has type 2 diabetes, in this case, the pancreas is producing insulin, but the problem is it's not working effectively. So it's not producing as much as it is needed to control the blood sugar. So even though, yes, insulin is being produced, it could be that there is some form of insulin resistance. So glucose is not being reduced in the bloodstream because the insulin is not working effectively. So that's basically the difference between type 1 versus type 2 diabetes. Now, how do you know if you are diabetic? In order for you to know if you are diabetic, you need to know something called the hemoglobin A1C. Okay, hemoglobin A1C. How do you know your hemoglobin A1C? You go see your primary care doctor. They will do your blood work, and based on the blood work, they will come up with a number. Well, if you are below 5.7%, it's normal. If you are between 5.7 to 6.5, you are at risk for diabetes. You are pre-diabetic. Anything over 6.5 is straight diabetes. So make sure you know your A1C. Make sure you know your A1C. Every time you go to your primary care doctor, make sure you know your status, okay? Thank you, and God bless you for watching this video.